2022 ACR Integrative RA treatment is the first of its kind. Can you provide a brief background as to what these guidelines are around and for whom?
Certainly. So this is a very exciting guideline that I'm very proud to be able to chat with you today. And the reason that this is so important is that patients with rheumatoid arthritis, like other types of inflammatory arthritis, have this on their mind from the time of diagnosis for as long as they live with the condition. So the focus of this particular guideline is not what doctors often think about, which is what treatment, what immunomodulatory therapies might be most suitable and how to monitor them and what works and safety, but rather the things that are much more under patients' control and frankly, the things that they may even care about more. Things like exercise, rehabilitation, diet, and healthy body weight. In addition, it covers integrative interventions that many turn to. So for example, cognitive behavioral therapy, sometimes aspects of wellness, chiropractic, massage, things that are occasionally in the complementary and alternative medicine space. And frankly, those things for many patients are much more actionable and frankly, more near and dear to their heart. So it's great to be able to have some formal guidance in RA for those kinds of things.
From a medical perspective, why are these guidelines important for both doctors and patients?
So the guidelines are important because it allows patients to be more participatory in their own care. Patients by themselves are not going to be, prescribing and taking a new medicine. We're going to work with their rheumatology provider to do that. But many of the things in this guideline, for example, diet or exercise, are things that patients can do on their own. And so I think because not only is it an important topic, but also it's something that patients can really take the initiative on, I think that's helpful. The other complementary aspect to that is a note of caution perhaps for patients to be aware of is that sometimes rheumatologists are not the most expert specialist for some of the aspects that are described in these guidelines. And so there may be other members of a patient's healthcare team that they want to consult with, occupational therapy, physical therapy, a registered dietitian, for example, perhaps even a personal trainer that they work with that can become part of a more expansive care team than just the rheumatology provider and the patient as a twosome.